Vaccine coverage continues right now as the Target 12 investigators keep tracking the state's rollout plan. Our Eli Sherman has been covering this process from the very beginning, and he joins us now live via Zoom. Eli, we want to get into the details about what people should know about getting their shots, but first, can you update us on where Rhode Island stands right now with the numbers of vaccinations?
Yeah, so Rhode Island continues to vaccinate people at a relatively consistent pace, but it is moving pretty slowly. As of today, you guys mentioned about 65,000 Rhode Islanders have gotten a vaccine shot, and 23,000 of those people have gotten 2 doses, meaning they're fully vaccinated. Put another way, that's about 2% of the state's 1 million people that have been fully vaccinated since this process started about a month and a half ago.
Eli, and to remind folks, those vaccines have been going to healthcare workers, nursing home residents, a few other specific groups. As Brandon mentioned earlier, the state is moving on to adults 75 years and older. So what should that group know right now about how to get this vaccine?
It's still a bit of a mixed bag right now, but the state's health director, Dr. Nicole Alexander-Scott, said yesterday that people 75 years and older do not need to take any action right now to schedule appointments. Within the next couple of weeks, the state expects to set up an official online registry where people will be able to sign up and then be notified when it's their turn for the vaccine. And they also say that they plan to set up a 1-800 hotline for people who have special needs. Until then, state and local health officials tell us that they'll be reaching out directly to people who are 75 years and older living at home. So those people should really pay attention closely to local city and town websites. I should also note that as soon as we get any updates, we will continue to report those out right away.
Eli, I know a lot of this is fluid. Clearly a lot still coming together to make this work. But taking a look at the big picture for a second, we've been talking a lot about people 75 and plus, but what about people under the age of 75? When can they reasonably expect to get a vaccine?
Yeah, it's going to come down to age, underlying health conditions, and geography. Health officials tell us that adults 65 to 74 years old should start to be getting vaccinated around mid to late February. There should be some overlap there with the folks who are 75 years and older. After that, the state's going to prioritize based on folks who have high-risk health conditions, and then they'll move down from old to young. And there's going to be some special consideration given to folks in communities that have been hit hardest by the coronavirus. You can see from this chart that there's a rough timeline in place that based on current supply, older adults could start getting vaccinated next month. And then younger, healthy 16 to 39-year-olds might have to wait until June, July, or even later. The biggest variable here, Kim, of course, is vaccine supply. If the state were to get more of the vaccine, either through a boost in manufacturing or if more vaccines get approved as the Johnson & Johnson, like you mentioned, this whole process would speed up.
Eli, a lot to keep track of. You are all over it. Thank you so much for being with us today.